With that note, ladies and gentlemen, we now move on to our next partner spotlight. HxAI, AI transformation partner for healthcare ecosystem, combines healthcare, specialized engineering, proprietary AI platforms, and an outcome-driven approach to healthcare organization modernize systems, deploy AI agents, and improve clinical, operational, and financial performance. Built for healthcare ecosystem, HxAI focuses on HIPAA compliant AI, secure data infrastructure, and FHIR HL7 interoperability, helping organizations adopt AI with confidence. To share more about driving AI-powered transformational in healthcare, we have with us Gayathri Vivekanandan, Chief Executive Officer of HxAI with over 30 years of experience in technology and digital transformation. Gayathri is leading HxAI's vision to help healthcare organizations embrace secure, scalable, and outcome-driven AI transformation. So once again, please put your hands together and join me in welcoming Gayathri Vivekanandan. A big round of applause, everybody. Welcome to you, madam, and over to you.
Good afternoon, all. From morning, it's been very, very insightful, okay? So I've learned a lot from each one of you who were on stage and who discussed with me offline as well. I'll try to cover as much as possible in this discussion. Otherwise, we'll catch up during the rest of the day, okay? So a lot has been discussed about leveraging tech, explicitly AI, for healthcare, right? So every decade, if you look at a major tech shift will happen and healthcare will have a fundamental shift in the way care is delivered to patients, right? First, we got EHRs, then we saw digital health, then COVID came, a lot changed. And now it's AI. That's why we are discussing AI a lot, right? I would like to start my conversation with two things. First, AI is going to be an enabler and it's never going to be a disruptor, which will, sort of impact the physicians or the nurses' life in a negative way, right? Whether it's clinical or non-clinical use cases that we aspire to transform using AI, they will all be transforming the lives, clinicians, patients, nurses, ops staff, any user persona you take. Right? So for Medtronic Labs, people were asking about the products that we have delivered in the past. Medtronic Labs has been our client for the last many years. Okay, so they take health patients in underserved countries like Kenya, Bangladesh, and so on. We have developed ML solutions. So AI has come recently. This was way back when ML was primary, and a lot of patients will queue up and physicians will definitely get burnt out, right? So there will be a lot of false positives, false negatives. Like people will think that they have problems, they'll line up in the queue and they will not have problems at all. So the clinicians will be wasting time on them rather than focusing on people who need care, right? So we developed a ML application which will help the clinicians, the doctors to pick the right set of patients who need immediate attention. Right? That enables patient care, right? So that is the set of use cases that we are looking at transforming, right? So HxAI, we are the AI transformation partner built exclusively for AI, right? So we have been talking from the morning also. Healthcare is not like any other domain, right? It's not like retail, insurance, banking, or any other domain because healthcare touches patient's life. Any small mistake happens, any small error that happens, it's not going to impact just a loss of a few dollars or losing one or two clients. It's like the patient's life which is in play here. That is why what we thought was we will deploy the tech expertise we have, combine it with the domain experience we have, and help transform enterprises. When we say enterprises, it could be healthcare providers, payers, health tech firms, or health innovators. That is the play that HxAI has. and I'm happy to be here to talk a little more about it. I would probably skip this because I've been here for the last more than 3 decades with IT, helping enterprises transform their business using primarily technology, right? But one thing that I've learned in the last 30 plus years is healthcare is a different animal altogether, right? You cannot treat it like anything else because the fancy or the sophisticated algorithms, models, or demos is not going to cut, right? So it is the patient outcomes that matters here. That is how healthcare is different, and that's why we are focusing exclusively on healthcare, because if you have a horizontal tech player, they might use the same technology across any domain problem, whereas healthcare is very, very unique because there's a lot of security, privacy, compliance requirements, irrespective of the geography, whether it's US, Europe, India, you take any geography, obviously the privacy and security of the data, sensitive information about the patient, all those need to be guarded by your agents, AI modules, any programs that you write. So that is where HxAI exactly fits in, okay? See, when we spoke in the morning about GPT, how comfortable the doctors are when the patients check, their diagnosis with GPTs of the world and come to you. The one main problem is there's a plus and there's a minus also. AI transformation is real. AI is going to impact every industry positively because AI models are very capable these days, right? So it's left to us, the tech players and the physicians, the nurses, the hospitals, the providers, to work together and ensure that these models, the large and small language models, AI, anything you call, to the benefit of the patients, to improve the patient outcomes. So one is, yes, patient outcomes. We were discussing in the morning, it's not only the clinicians who serve the patients, non-clinicians like nurses play a very big role, right? I was talking to a nurse, right? And she was explaining to me onto the patient onboarding questionnaire, okay? So this was a I was talking to Dr. Uma also this morning. This was for a rheumatology patient. I was the caregiver there in that scenario. The nurse, right? So she was asking a lot of questions because rheumatology, the doctor will expect a lot of information about the patient, right? So she was asking, do you have, a pain in the joints and all that? Then she was just going through the question and asking. Obviously, she'll be burnt out because I might have been the 30th patient or 40th patient, right? Then she asked, does the patient have joint pains? Okay. I said, yes. But then she skipped to the next one. Then I said, no, do you want to ask whether the joint pain is symmetrical? Meaning, if the pain is there, felt on the right hand joint, the patient should also have it on the left hand. That's a clinical thing that they check. Probably the nurse was so burnt out because she wanted to check everything and give it to the doctor on time, right? So those are the places which can be really benefited by technology, ML or AI, right? So that is the positive note with which I want to start. While we have the GPTs, clouds of the world, they are going to have the same technology applied everywhere, but that will not suffice because healthcare, as we have seen from the morning, requires much, much deeper understanding of the domain, the lives of clinicians, doctors, nurses, and so on. That is exactly the strength that we have at HxAI, which will help the innovators to get to products that will really solve the problem on hand. So these are the three things that will really position HxAI as the very good partner for transforming the healthcare enterprises. One, we have been working with healthcare sector for the last 16 years, meaning providers, payers, all user personas. So the engineers on the ground understand the criticality of the workflows. They understand, if you say face-to-face audit workflow, they understand. If you say patient onboarding workflow, they understand. So they understand everything. So it's easy for the person who's explaining the problem to the engineering team, right? So it is not that these people will have to start from scratch, ask you about everything, that every jargon, every term that you're using while describing your problem. One, they know that while the doctor or the nurse is explaining the problem, they should also understand different perspectives of the problem from other users in the ecosystem. It could be the CFO, it could be the CEO, it could be a head nurse, it could be staff nurse, it could be anybody. So these information, or the criticality of getting the information, is ingrained into the DNA of the employees. That cuts a very big positive thing when we work with healthcare providers. Second thing is, as we rightly said, AI is a big ocean, and having the horizontal AI is not going to cut, right? So we have developed a lot of AI components and non-AI components as well, which will give a head start to the team. Otherwise, the healthcare users will ask for a product, and the team will spend a lot of time to take even the minimum viable version to the users, mainly because they will have to start again and again from square zero. So here we have got a lot of accelerators assets built, and the IP will not be ours because they are all open sourced. So it will be given to the healthcare firm, right? So that is the second one. It will all be compliant to the security and governance, audit, whatever needs are there. This will help. I'll give you one example. We were talking about AI or the technology being an enabler and not a disabler, right? So if you take audits, everything has to be audited, meaning you need to have a trail as to who did what, right? For compliance perspective. Usually what happens is lack of bandwidth and lack of budget makes this as a year-end activity. We don't do the necessary data capture for audit. We always push it, right? Most of us would agree for that. It will all be pushed to the year-end when the compliance audit is planned. But AI can be used to gather the evidence then and there, so traceability is maintained and audit is not a problem at all. One example. The second one is when you need to transfer sensitive patient data across, right? Most of the organizations ensure that the security is very tight, the place where it is saved. But when it is in flight, when it's moving from one service to the other, very many times, it can be hacked. So these are, abstracted and built as assets from our side. We have ePHI handler, in-house built asset. We have fire compliant, we have fire viewers. So anything that you, an engineer, be an AI and non-AI engineer, needs to build the product, those foundational blocks are already built so that they will definitely have a head start. And you will have a product where you can see what you have aspired for in a few months and not few quarters, right? That is one. Uma ma'am was also telling in the morning, and many of you have covered in the, your discussions, outcome, having an idea of what outcome is your goal has to be understood by the person who's working on it. We worked on a non-clinical use case where there were 802 reports that were submitted to the CFO of the hospital. 802. Imagine how comprehensive a reporting system they had. But the CFO was telling us that every day he used to call the analyst and ask questions in plain English and getting the answer because the reports were not meeting the purpose at all, right? So, we were also discussing that a lot of non-clinical, stuff happens, very intensive operations in healthcare, he was explaining. So, such flows can be automated using AI, which will help the physicians focus on their patient care rather than getting to work on checking the data every day or every hour and so on, right? Those are the three pillars that we focused on for the last 16 years, which has helped us to come to this, stage where HxAI can proudly say that any business problem you have, big or small, we'll be able to work with you and deliver it, right? So I covered this in the previous slide itself. These days, clients are not sitting and coding the entire requirements as a scope document. Gone are those days when we used to get the requirements in detail, fine-grained, and we as the engineering team will have sequence of months, sprints to deliver it. These days, clients send hardly 1 or 2 line requirements. Then it's up to us to deploy forward deployed engineers who will be embedded in the client's ecosystem. See, for example, a maternity firm. So they want to optimize the patient care. Okay, so they say that the patient intake is taking a lot of time. So can you come and develop something, right? So in that case, we will have people who will be sitting with the client in the client ecosystem, who will be equipped to understand the terminologies, the jargons, the language of the user personas in the maternity clinic. Understand, deliver. And he will not be having this in his plate for weeks together. Instead, he'll be using the right AI tool to give you the demos then and there. You give the requirements in the morning, he or she will give a demo probably in a day or two, so that not much of time will be wasted in communication gap. We saw all this from morning, right? So understanding what the client is saying is a very big thing, right? So translating it was the right term that we were using in the morning. So translating what you need into the tech is very important, and that's where we have 400 plus FDEs who will get embedded into the client ecosystem, use AI tool very, very progressively, ensure that transparency is there, you know what is happening, and deliver it to you. That doesn't happen in a day or two because the domain is very complex. You cannot give a crash course over a weekend and expect the developer to become a domain expert, right? So it has to be ingrained in the DNA that privacy is important, security is important, compliance is important, so on and so forth. It's taken us 16 years of having these engineers understand the domain as such. So we bring in a combination of engineering talent who have very good depth of AI and who understand the domain, right? That right combination is the killer combination. We have implemented a lot of healthcare uses across use cases, across geographies, and that is our specialty. For example, ProDoc, they've taken one geography, one product idea, and they're taking it to market. We work on a completely different space. So we work with Roche or Mayo Clinic or Apollo or whichever, understand their business problem, convert it into a technology, a system that helps them to modernize. This is actually a very tech slide. I'll make it very simple because I'm not sure whether we want to really drill down to the tech that much. Probably if someone is very interested to understand the tech aspect of it, we can discuss during lunch or after that, right? 1 or 2 points I would like to touch. See, we have developed 3 AI platforms and services which will help. One is AntiClock, the other one is AgentHero, but I would like to touch upon the SLM-in-a-Box, okay? So from morning, we have been having discussions supporting and not so very supporting of LLMs, the large models, right? We recommend SLMs for many of our clients because many of the healthcare use cases are very focused. Understand the clinical documents like discharge summaries or plan of care or whatnot, clinicians' notes, right? Understand that come up and get it into a structured format. Then I will decide whether I want to see a report or whether I want to see a dashboard or an AI use case, right? So for that, data is sensitive. Data lies with the provider in their own on-prem or private cloud. So we develop and support, recommend SLMs which are hyper-trained for the data that's used for your use case, right? So that is why we recommend SLM. It's not only SLM recommendation, we do the entire 9 yards for them. We identify the SLM. Data is a mess. Healthcare enterprises sit on vast amount of data. Ma'am was also explaining in the morning. Data is in heterogeneous systems. They will use, there will be a lot of terminologies you have to use, protocols and all that. No, on the ground, if you look at lot of duplication, lot of errors in the way data is keyed in the system, it all depends on the maturity of the person who's keyed in, right? So cleaning up the data, getting it ready, ensuring that SLM is trained on the right data, because garbage in, garbage out. So we need to train the data and deploy it to the client so the clients get the right outcome that they have in mind, okay? So I would strongly suggest that for any focused healthcare use case, rather than going for a LLM, a generic one, we should go for a SLM, which is hyper-trained for your use case. That will be very, very applicable. Other aspects of SLMs are, when compared to LLMs, SLMs are very favorable because it runs in your on-prem environment. One, data and the model lies in your area of comfort, right? So you will have more confidence to scale up the innovation in your enterprise. One. Second, cost predictability is there. If one AI agent runs amok, you will end up paying a huge bill. FinOps is becoming because AI, many enterprises want to innovate. They go the AI route, but the bills, you just can't imagine. It's huge. It's huge, right? So we need to have SLMs which will run in your thing. You will know what's happening. Cost predictability is there. In fact, prediction of the results is also much better because it's a controlled domain, right? So that is also there. So we provide that as a service. We do have a lot of tech components, probably. Given the short time, I'll probably skip them. AgentHero, which will help develop agents for your system. If you have an audit process, if you have a patient onboarding process, whichever process, we can develop small agents. I would like to cover one point here, okay? If the doctor or the nurse gives a product idea, it's not that we will develop it as a one single chunk and give it to you, right? We will break it into 10 different steps, make each one as a separate agent. After each agent runs, we will have the human in the loop. So there will be a human, a nurse, or clinician, whoever, to check whether the recommendation or the action done by the agent is correct. Only then it will move to the next phase. Because a lot of trust has to be built into the system, right? So we break the entire workflow into multiple different pieces. Each one will be done by an agent, and the entire agent sequence will be orchestrated together. And everywhere there'll be human in the loop, and only when it is said, it's done, it's correct, it will go. Second, every agent will have a unique ID. So you will know who acted on what. There is nothing, it's like, Raghu also said, it's like writing on the stone. No one can go and erase that I didn't do, she used my ID. Nothing like that happens. So the trust, security, everything is also taken care by this. AgentHero is it's an AI platform which helps us to build agents very fast. Otherwise, teams tend to spend a lot of time to develop agents. So we have built this as a reusable, platform exclusively for healthcare. Again, we do not focus on horizontals. We focus only on healthcare. See, one other aspect about trust from the other angle, right? So we were talking about a lot of trust-related points discussed. If you look at the healthcare partners that we have worked with, they've all been with us for very many years, 16 years, 15 years, 14 years. And in fact, as a side note, these the leaders, the healthcare leaders from here go and refer us to other, healthcare founders who are looking at tech firms, right? Because they know that we understand compliance really well, security really well, the audit needs. So that is where we play a big role in the healthcare environment. The products that we develop for Roche or Mayo Clinic or any, so it covers across countries. We have also delivered it to Kenya, Bangladesh and others, and a few in India as well. We have our own products rolled out in India, on HMS and all that. So we understand the interoperability issues, the data issues, the challenges faced by different personas, but we are geared up we aspire to deliver more. As someone was asking this morning, we do not have a magical wand as of now, but that's what we are aspiring to get to all of us. Okay? That's it from me. Thank you for your time, that was just before lunch. I would probably suggest one thing, since it's late for lunch. If you have any questions, we can take it over lunch. Yep. Thank you. Thanks.
Thank you, ma'am. Thank you so much. I request you to kindly remain on the stage, and I request Mr. KP Nadik to kindly join us on stage to hand over the token of appreciation for Gayathri Vivekanandan. Thank you so much for your valuable insights. Your perspectives have given us a great understanding of the opportunities that lies ahead in healthcare and the power of AI. Thank you so much, madam.